Good morning. The last few months have been like nothing we have seen before in our lifetime. Lives have been lost, livelihoods have been destroyed, and everybody wants to get back to normal. But we can't undo any of the good work that we've done here in St. Louis County to allow us to have a different experience than other people in our country and other people in the world. Along with the city of St. Louis and St. Louis County, we have over half of the cases in the state of Missouri. I've spoken to the governor about this as recently as yesterday, and he understands that local decisions are important, and it's important that the St. Louis region has the ability to react differently to our unique situation than the rest of the state. I've spoken to Dr. Garza, the head of the St. Louis Metropolitan Pandemic Task Force, and he also understands our position and agrees and advises that a slow, responsible, and measured and deliberate reopening can be done as long as we maintain social distancing, we limit crowd sizes, and we all wear masks. As I said all along, we will let data drive our decision. We're watching hospitalizations, ICU admissions, ventilator usage, and we're also watching hospital admissions. We're looking at the testing results. As testing becomes more available in our region, we expect those results to increase as we test more people. We'll be watching the positive tests and the negative tests as well. We need more testing. We don't have enough testing in our country. We don't have enough testing in our community. And later on this morning, we'll know the response to our invitation for bids for St. Louis County for people to sell us testing supplies. And we'll have an idea about what's in the pipeline and what we'll be able to purchase. More testing becomes more available every day, but we are not where we need to be. We are also hiring more people to do contact tracing. Contact tracing is a very important part of a public health strategy. We would like to shift deliberately and in a measured way from quarantining and limiting the activity in large sections of our community to focusing on hotspots, senior living centers, congregated living centers, and areas in our community that are more impacted, and begin to focus our efforts on individuals who are COVID-19 positive, to trace their contacts, to advise and quarantine their contacts where necessary, and shift to a more measured public health strategy. St. Louis County and St. Louis City have targeted May 18th as the first day to begin to ease our public health orders. Mayor Cruz and I talk about this frequently, and our public health departments are in contact on a daily basis. Many businesses will be able to reopen following social distancing guidelines. We will request all businesses to have their employees wear masks, and we will request everyone out in public to wear a mask, especially when social distancing measures being at least 6 feet away from someone else can't be easily followed. We will have more detailed guidelines for businesses specific to their industry, and those will come later in the week. We're working on those with the City of St. Louis, and we will have those in alignment as much as possible. St. Louis City is different demographically than St. Louis County. They have different types of businesses, but for the most part, we believe that we will be very closely aligned. We must get our economy going again, and we understand that, but our first priority will always be to save lives, to protect the health and welfare of everyone in our community, and that's how we're going to drive this question moving forward. And we have to move forward in a responsible manner. If we move too quickly, we know what can happen. We can have a second wave, and it can be much worse than the first wave. More lives lost and a much more devastating economic impact than what we're already experiencing. Last week, I announced up to $17.5 million of small business grants that would be available in St. Louis County. I'm pleased to see that our council members have engaged in that process. They are working with local elected officials and community leaders to make sure that those funds get to the businesses that need them the most. We understand that there was significant stimulus federal money offered to our business community and our large employers and small employers. We're looking for needs and how to fill those gaps for the ones that could not access those funds. I recognize the anxiety and tension in our community as we begin to discuss the process of a slow and deliberate and a measured reopening and easing of our public health orders. This will be slow, but we will get us moving forward safely towards a new normal. And I'd be glad to answer any questions.
Dr. Page, you talked about the differences between the county and the city when it comes to various businesses, et cetera. Could you give a few examples of that?
Well, St. Louis City is more densely packed, but I think that'll be easier to understand when we release those business guidelines in a couple of days. You know, St. Louis County is more suburban and more spread out, you know, that would be the most obvious difference. But as far as those businesses, I would like to wait until those business guidelines come out, and I think you'll see alignment in nearly every aspect of it.
Can you talk a little bit about how that's going to work? I mean, I'm assuming that someone will go online and they will look and see what type of business they are, and then they will see what...
We have many people working on this. We're working with our civic leaders, all civic organizations, the St. Louis Economic Development Partnership, you know, our own public health department, the St. Louis City Public Health Department. We have national resources. We have industry-specific national resources, and all of these are coming together to provide business guidance. They'll be widely distributed. They'll be available online. I'm sure they'll be published widely in our community, and our businesses will have well over a week to adopt them and get comfortable. Not everyone will open on May 18th, and we've seen that around the country and around our region. Some will be more deliberate, some will be slower, and we know that not everyone is going to rush. Many people in our community are not yet ready to start moving about more. They're going to be much more cautious, and we expect that, and we think that's reasonable. They will look around and they will be watching to see which businesses inspire confidence with their social distancing measures that they've adopted. And the ones that do look like they've adopted social distancing measures that look inviting and reassuring, then the word will get around very quickly.
Do you know which businesses could be the first to reopen, which ones will have that open date of the 18th?
You know, I'd like to wait until we polish up our guidelines before we get any more specific. I think that's fair. Obviously, we'll be looking at some of our businesses that are currently closed, and we'll start with that group. I think it's very important to recognize that we are going to move slowly and deliberately in a measured way. And we also will recognize that as we begin to ease our public health orders, that the virus will begin to move about our community, and we need to be ready to test and isolate people who are infected. And our approach to relaxing social distancing measures and public health orders will be focused on public health and public safety, and it will be very thoughtful and deliberate.
So those guidelines would have, you know, kind of the type of business, an opening date, and then also guidelines of...
It will have a type of business and general recommendations, and then we will have some more specific guidelines that we've been working on with a lot of our partners in public health and our civic leaders in our business community.
Because restaurants and the food service industry, first of all, you have so many people working in the restaurants, and then for whatever reason, people are just anxious to get out and socialize and get out and eat. Can you talk specifically about the food industry?
Yeah, sure. Some people are anxious to get out and socialize. Some people want to wait and watch. I would say most people are going to wait and watch. I don't expect a big rush to the restaurants. We will talk about limitations of capacity in restaurants, but I want to wait, and as our public health officials are working on those guidelines, you know, in the St. Louis County and St. Louis City, I want to wait and talk more about that after we continue those discussions over today and tomorrow.
I know it hasn't been that long, but have you learned anything from some of the other counties around the state?
The biggest lesson is that there is not a big intensity to rush. A lot of people are waiting and watching to see what's going to happen. People understand how serious this virus is and how it's impacted our health and how it's impacted our economy, and they're trying to find the right balance. But the vast majority of folks, businesses and their customers, are respecting social distancing guidelines and trying to move forward in a safe manner.
Is size of a business a factor of this square footage in terms of whether or not they will or will not be able to open?
We'll have more specifics on that in a couple of days. I think that would be a detail we're going to develop a little bit more on. We're still working all of those out, and we want to make sure we're clear and concise when we start to talk about that.
Is there a red line or something else you're going to be looking at, some sort of metric to hit that you will pull these back if infections hit a certain point, or that curve looks the wrong way?
Yeah, so I think that's a good question. We're in the absence of really robust testing, and we're not there. In the absence of testing, then we have to watch our hospital data. And the best number to watch would be hospitalizations, and more specifically, hospital admissions. Hospitalizations is a different metric than hospital admissions. Hospital admissions is a single point the day it happens. Hospitalizations varies depending on how sick people are. We will get better at taking care of people who are sick and in the hospital with new therapies. There is not really a breakthrough, but there are some things that are hopeful. The convalescent plasma therapy, the plasma from someone who has recovered from COVID-19 has been helpful in some settings. There's a new antiviral agent that we've all read about that was recently approved by the FDA. That brings some hope. And it's very exciting that a vaccine is being produced and tested right now. It's being produced right here in St. Louis County. But we don't know necessarily that vaccine will be available before the end of the year. The vaccine is what gets us back to where we were before. Until then, we are in a new normal. We're in a new normal where we respect social distancing, we wear masks, and we try to limit the spread of this in the community.
When it comes to wearing masks, what's the approach going to be? I mean, would it be some of these businesses that are allowed to, again, reopen their doors, required, suggested, somewhere in between?
It will be a requirement, and I will be very surprised if businesses whose employees are not wearing masks will get much traffic.
To go back to my last question, are you accepting that at least at some level more people will get sick after May 18th, that we won't continue a straight downward slide, that as people start to go out and about, we might see at least a small spike?
I wouldn't call it a spike. I would say that we would see a trend. If we see a spike, we'll react quickly. But we know that when we ease our public health orders, we will see a trend upward, and we'll be watching that trend, and we'll be working hard to manage that trend like most epidemics would be managed. Test, isolate, do contact tracing, quarantine individuals who made contact when that's the right thing to do, and try to focus our public health strategy on people who are sick or exposed to people who are sick, and let other people move about more freely. And I think we'll see a very slow and measured and cautious approach by people. Even as we start to ease these restrictions, I would expect a lot of caution in our community.
How much have you relied on what you've heard from the White House Task Force and their guidance on reopening versus conversations you're having more locally?
I think Dr. Fauci has been helpful. I think the CDC has been helpful. I think Dr. Garza and the Metropolitan Pandemic Task Force is extraordinarily helpful. They have good resources. Our hospital systems are working well together, and they have accessed very, very bright people at St. Louis University and Washington University. We have two of the best departments and schools of public health in the United States right here in St. Louis, not one but two, and we're accessing those resources.
I'm sorry, just for clarification regarding the masks, are you saying it'll be a requirement for the employees and for any customers who enter some of these areas?
We are working on a requirement that will allow any business to refuse to serve anyone who comes in without a mask. We are not going to be in the space of policing the general public who wear masks. It will be strongly, strongly encouraged. It is certainly prudent, but businesses, I believe, who do not have employees wearing masks will be policed more frequently by their customers than us. But we will be watching those, we will respond to those complaints, and we will track those.
So since not all businesses will be able to start their reopen process on the 18th.
Right.
Is this a phased approach? Are we going to go in different phases?
We'll have more details on that in a couple of days. We are not going to commit to the next phase until we see the trend in the data. We will watch and see what happens with this next step, and we will watch the data points that we're watching surrounding hospitals. We will watch the data points that will be much more useful as we get more testing in our community. Watching those testing results will give us better information. We are going to work. We believe that our coordinated relationship with the City of St. Louis has been very productive. It's been very helpful for our region, and we're going to work with St. Louis City as closely as possible in all of the next steps.
Dr. Page, we have a couple of questions. One from the Post-Dispatch and one from the American are both basically about data. What science, what data do you look at in being confident that this is the right time for it?
And we're going to watch the hospital trends, more importantly, the hospital admissions, and make sure that they are headed in the right direction. And we have several more days of data to come in. We are going to watch our ability to test. So one of my big data points is my ability to purchase testing supplies for St. Louis County, and then the results of those tests. We know that we are trending on a 7-day average slightly in the right direction. Not enthusiastically in the right direction, but we're trending slightly in the right direction. We're going to watch that trend. We're going to be very cautious with our reopening strategy, and we're going to be cautious as we begin to deliberately ease our public health orders.
Can you talk a little bit about purchasing, like you said, the testing, et
Yeah.
cetera? Who are you competing with?
Oh, we're competing with everyone in the world, for sure. We're competing with everyone in our country. If we're able to purchase a vibrant testing supply pipeline, we will share those regionally because this really is a regional approach. This virus does not know jurisdictional boundaries. And we will share them with our testing partners in the communities. We have several groups, well-respected groups that are standing up testing centers, and we will be developing a coordinated testing strategy with them.
We saw that mobile testing site that was in,
Mhm.
that's been going around yesterday, it was about a family life, and the line there was enormous.
Mhm.
Are we gonna see more of those moving around?
Yeah, we won't have enough tests to fill the enthusiasm to be tested for a long time, but we would like to have enough tests to test everyone who's symptomatic, and that is really the standard. Can we test everyone in our community who has symptoms? In the past, we've been limited to people who have symptoms who are high risk or are first responders. But we want to be able to test everyone who has symptoms, and then when we have an outbreak in any place that's congregated, then we want to be able to test everyone in that group who's asymptomatic. And then we want to do testing of pockets in our community to see what the prevalence is in various pockets. And then we want to do antibody testing, which is a completely different type, not just testing for acute infections, who's sick right now, but antibody testing about who's been exposed. And that provides us with important data about people who have recovered and the percentage of people who have been infected in our community. That's important for planning purposes as well.
How far away do you think we are from a point at which I can just call up my doctor and get either one of those tests just so I can feel confident to go visit my parents in another state or travel for work?
I think that if you were symptomatic, you could get, we should be a few days away from being able to get a test for everyone who's symptomatic. I think we're pretty close to that. In fact, there's probably some places around town where you could go. But asymptomatic tests, because you just wanted to know to travel, I can't tell you that. I think we're trending in the right direction. I don't know if it's weeks, but I would expect that that's not that far away, where anyone who's asymptomatic who wants a test, who didn't have a high risk to exposure, we should be pretty close to that. I know some of the testing centers around town have varied their strategies a little bit, and they are testing asymptomatic individuals. But for anyone to be able to have asymptomatic tests, to do large asymptomatic studies, I don't think we're there right now. It'd be great if we could be there in a couple of weeks. I'd be a lot more reassured if we could. I know that I read, maybe Los Angeles it was, said they were going to test everybody in Los Angeles. That's great. I expect that they'll have to plan that out over time as the testing supplies come in. Any other questions?
So, one more. So if it's a follow-up, if between now and the 19th, the numbers that you've been looking at now that look promising change, and we're seeing those hospitalization numbers go up, what happens between now and the 19th?
You mean if the data goes in the wrong direction?
Correct, yeah.
Well, anytime data goes in the wrong direction, you would reevaluate or modify your decisions for sure. But I think we just need to see where that's going and what happens. Right now, the trend is in the right direction. It's just not a robust trend, but it is in the right direction. And we'll be watching that closely. I wouldn't expect to see a large change in that trend until we begin to ease some of the social distancing guidelines, but we're going to watch all the data. And if we see something unexpected, then we may modify our orders.
All of that, all of the testing and the data that you're looking at is just to make sure that the healthcare system can handle an uptick in patients, right? I mean, that's generally what we look at.
That's one variable. We want to make sure that the health system can handle it right now, and it can handle it in what might come down the road. And we want to make sure that the presence of the virus in the community is trending in the right direction, because we know when we begin to ease that it's going to go in the other direction. And it's not just that it increases in the community. The rate of that increase is very important to us so that we can manage it, so the hospital systems can manage it.
Just
Yeah.
quick takeaway, what new information can we go to with businesses today? What new information are you?
Well, we have a target, May 18th. I think that's important information, that we will expect social distancing measures that are very similar to what they're seeing across the state and across the country, as far as being prepared to wear a mask and being prepared to keep people 6 feet apart within their business, and stand by. We will have more instructions moving forward in the next couple of days, and you should have plenty of time to implement those guidelines before May 18th.
And if your industry does not get open May 18th, will you give a week's notice before?
Yes, we will always try and give people a week to prepare for any change in our expectation of what would be required and what would be safe in their business.
Anyone else?
Okay, thank you.